Good afternoon and welcome to Lunch with Lisa, week 7. I feel like I say this every week. Who'd have known that we'd be doing this for 7 weeks, but we are on episode 31. And I want to thank Dr. Steven Spitz for joining us today. A hot topic is what's opening back up and are you going to the dentist? Because if you're like me, I was actually due for a cleaning right before we went into quarantine and I'm ready to get back in. I love having my teeth cleaned. I actually love my dentist appointments. I've been super fortunate that I've been going to Smileboston since they opened in 1997 by Dr. Spitz. And I'm glad that we've had a great friendship over the years, but I also love having my dentist as my friend because, well, every time I have anything with my teeth, I call him right up to see what to do about it. But let me introduce Dr. Spitz. He is the founder and prosthodontist and owner of Smileboston Cosmetic and Implant Dentistry. And you know what I just did? I went and minimized the rest of your bio. And isn't that silly? Because I should know it like the back of my hand. You're a prosthodontist, a specialist of dental restoration. You went to Tufts and Harvard School of Dental Medicine. You were the first prosthodontist in the country to place implants using lasers. I remember that. You wrote that original surgery. The only prosthodontist in the world who is advanced certified in pinhole surgical treatment, which I actually want to talk to you about because that's when your gums recess a little bit. Right, Steve?
That's correct.
And you have to have that fixed, and we need to talk about that. You are the former dentist for the Boston Red Sox and the dentist on call for the animals at Zoo New England, which is also a hobby and passion of yours. So thank you so much for joining us today.
Well, thank you so much for having me. It's absolutely a pleasure. And Lisa, you've known me long enough. I love talking about dentistry. I love what I do. I love making people smile. It's absolutely an honor and a privilege to be doing what I do. So love talking about it.
Great. Well, I am so thrilled that you're here because this was a hot topic. I even heard about it on BZ 1030 was talking about it this morning, what it would be like to be back at the dentist's office. Of course, you are in your office at Smileboston today, and there's a lot of changes that will be happening. So walk me through, when I get to the dentist, how will this experience be different?
So great question. This is obviously unprecedented times. You've been hearing this and what did you say? This is your 8th week or 7th week of doing it? 7th week of doing this. So we've been out of the office now for basically 8 weeks doing, not doing what we were meant to do, which is take care of people. And although they've been, we are deemed obviously a necessary medical treatment, it has been deemed that we can only see emergencies and those urgent matters up until now. So it's going to be nice that they're lifting that ban and that we can start to see our patients for the more regular types of treatment, which you mentioned about just coming in for a dental hygiene visit, dental cleaning. That's a pretty serious type of treatment that we do, because what we're doing is we're trying to prevent periodontal disease. And so for the last 2 months, people that have had appointments for the last 2 months have all been canceled. And now we're going to try to get everybody back in. But we also want to do it in a safe manner where we're continuing the social distancing. We know this virus is not gone. We know it's still here, and and everybody is practicing their social distancing, and we're all wearing masks. So what are some of the things that you can expect? When you call and get your appointment, we're going to tell you to wait in your car and not to come up, not to get here early, because we want to minimize the number of people that are sitting in our reception area. So ask when you arrive, you call us, we'll tell you when to come in, and we'll have one of our team members escort you right into the treatment room so that we can take care of you.
So no more catching up on my People magazine and having a coffee before my appointment?
Yeah, unfortunately, we've removed all of those magazines and gotten rid of the coffee, from the office. So it's definitely going to be a little different. And which is, it's a new era, right? We've got to embrace what we have. What's great though is that once you are escorted into the room, we will be taking temperature. We'll be asking you to sign your consent forms just like normal, but you'll look around and you'll see things that maybe weren't covered in the past are now covered with plastic. Things that you're going to notice that your doctor and your hygienist are going to be wearing different clothes. So we're wearing disposable gowns and we're wearing face shields just as that added extra precaution. We're also asking you to rinse with a hydrogen peroxide mouth rinse prior to us doing any work, because that has been proven to kill the viruses that are in the mouth. So that reduces that exposure. And
what would that taste like? What's that experience in my mouth? Like that?
Oh, you're gonna love it. It's a minty flavor. It's just like any other mouthwash, but it's a protective one. So.
I'm glad that I asked that, because when I think of a hydrogen peroxide mouthwash, that doesn't sound super flavorful in a way that I want. So I'm glad that you said there's a minty version of that.
You don't want to just, I hate to say, there's obviously in the media and lots of funny things about, what people should be drinking or, protect themselves. And obviously those are all jokes and we don't want to go there. So, we're looking to keep you protected.
A quick question we have in the chat is, should we be rinsing with that at home? That's a really good question.
That is a great question, and that's certainly not a bad idea. There are certain mouthwashes that have the hydrogen peroxide and a 1% rinse, and if you can get it, the hardest part with all of these regulations, and it coming from the entire world, not just Massachusetts, is that everybody's looking for answers. Everybody's looking for, how can I protect myself? So a lot of these things are just not available, or they're not readily available. So
sure,
if you find it, absolutely.
We've had you on the news a couple times in the past couple of weeks talking about virtual appointments, because a lot of people were putting off emergencies. They might have tooth pain. They might have an issue they were concerned about. They didn't want to go into the dentist, or maybe they weren't calling. So you started doing virtual appointments. Are you still doing virtual appointments?
I am, and they are great. It's really just like a video conference like we're doing now, where we have that conversation, where you can, point out things that are either that you're not happy with, or things that you are happy with, and we can have that conversation. So it eliminates that extra time here in the office. So we can have that preliminary conversation where, let's say you're not happy with your smile. Let's say you've got recession and you're curious about the pinhole surgical technique. We can have that initial conversation over a video chat like this before coming into the office and doing the rest of the exam to see if you are a candidate for those types of procedures. But we can get a really good idea as far as what path we're going to go down and what that treatment might be like.
So the virtual appointments, I didn't even know that. They're not just for emergencies anymore. They're to do a consult.
They can be for consults. They can be for emergencies. It's what's great about it is that it's FaceTime with your dentist, right? Just like having a conversation with any other, I want to say medical professional, but now we can see each other.
Right. So I'll go back to that pinhole surgery. You, for many, 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 many years, told me to stop brushing hard with my toothbrush and to be using the electric toothbrush, and I didn't listen, and I don't even know why I didn't listen. I don't know why I wouldn't have. And now I have all this recession and sensitivity because of it. And what is that pinhole surgery that you are is it the most certified in the world? What is that surgery, Stephen? What would our consult look like?
So great question. So
I just turned my webinar into our consult. See how I did that?
Well, what's great, and this is a great conversation, and I love talking about it. But what's nice about, we always talk about what's the silver lining in all of this, where everybody's shut down and quote unquote can't work, or they're home and they're able to watch something like this. What's great is that we're constantly learning, right? And we're learning things every day, and some of the information that we thought we knew that we thought was correct 20 years ago, we're finding is a little different today. We're finding there's many correlations between oral health and the body, and I can go into a whole host of diseases that can't be controlled unless the mouth is controlled. Periodontal disease is under control, such as like diabetes can't be controlled unless your mouth is healthy.
Wow. Do people know that generally?
These are, I don't want to say they're new, but this is research that's been out for many years, and it's not talked about as often as it should. So many people don't know about these things.
Isn't there a correlation with, and again, I am not the dentist here, is it heart disease or something related to the heart you can see in the mouth?
We're finding the same bacteria in heart disease and in the heart that are in the mouth. So we know that those bacteria are traveling. So if you've got any type of heart disease, we want to get the gums under control. We want to get the mouth healthy so that we can maintain that healthy heart. So many correlations with medicine, and the more we learn, the more we say, wow, we are so connected that it's so important to get to your dentist, to get your health. If you want to maintain a healthy lifestyle, you've got to get your mouth healthy. So when we're talking about the pinhole, one of the things that we thought in the past, and many dentists are still believing this, or we're talking about it, but we thought the recession was caused by brushing too hard. And so we would say, oh, stop brushing so hard, or use a softer toothbrush. Well, today we know that recession is due to grinding our teeth. It's all about grinding our teeth, and those teeth don't want that kind of pressure on them. And I see that
we
look
know.
on your face, because
I'm the worst. I'm the worst. I am the worst teeth grinder of all times. I've caused all sorts of problems with my teeth because of my teeth grinding. I did not know that's why I was gonna have to do that pinhole now. And I have the bite guard.
So we know that recession is all stemmed from grinding our teeth. And then we can get into why we grind our teeth, but let's talk about that recession. So let's say we now know we grind our teeth, we've taken care of at least minimizing the damage. Now we want to fix that recession. Up until now, there's only been one surgical technique, and that is take a graft from the roof of the mouth, some skin, some tissue. I know it sounds gross, but we have to take some from the top of the mouth and then transplant it over the roots of those teeth that are exposed. Now, you can imagine we can't get that much tissue from up there, so you can only do 3 teeth at a time. And people would go back for multiple surgeries, and they'd have 2 surgical sites every time. And it was, many people have said, wow, that was really uncomfortable, and I'm not going back. I'm not going to do the rest. So fortunately, this CHO pinhole surgical technique has come out because it's really changed the way we can reverse that recession. And so we're now, using basically just a small pinhole to get underneath the tissue, which is basically doing like an endoscopic type of a procedure where we're just going through a small hole. The smaller the hole, the less inflammation, the quicker it heals, the less discomfort. And so this procedure, we can actually do the entire mouth in one surgery, and with very little, if any, discomfort. And it heals up beautifully. And it's utilizing we don't have to go to any other area to harvest tissue, because we're just using the body's ability to heal, and we're using some collagen that we can place underneath the gums in order to hold the space for our bodies to naturally regrow that tissue. So it's really an amazing procedure. I absolutely love doing it because you see the results immediately. You walk in with recession, you leave, and the teeth are covered, the roots are covered, and it just looks amazing.
So I'm thinking about that. So I haven't been in for my cleaning which is now an extra couple months at least. And I have this recession. And so again, the key is to do the consult with your doctor before you come in then, right? So we would do, and so should I call your office and make an appointment with you? Or how am I doing this? Even as your own patient, good to know, but how are people generally going to do that?
So you definitely want to call the office. We can certainly set up a virtual consult and get that initial step out of the way. The next is we need to get you in for hygiene, because we can't do this surgical procedure without having those teeth and the gums in pristine condition. So we need to make sure the gums are healthy. Then we can, during that visit, during your hygiene visit, we can take all the measurements and make the final plan for that pinhole surgery or whatever the next step is. And so that would be the procedure. First,
I'm sure that people might have some anxiety about having to go back. So what if I came in and you told me I needed a filling or something else done? Do you anticipate doing those appointments while we're there, or do you anticipate us coming back? And again, what does that look like?
Great question. And we're doing everything that we can to try to schedule enough time that if there's something that we notice that's urgent, we want to take care of it right away. We'd rather have you here for a little bit longer than have you come back, multiple times. So,
perfect.
It is important. If it's something more complex, what we're going to do is we're going to gather all our information, and then maybe we'll have that virtual consult in order to finalize the plan, and then we can have you back to execute that plan.
So the advice to people is to remember that we're going to be waiting in our car till we're ready to come up, and then we may be there a little longer than anticipated. Is there anything that we'll be wearing during the appointment that would be different than normal?
So you're going to come in wearing your mask, just like our governor has asked us all to do. We're going to ask you to wash your hands or use some antibacterial hand sanitizer. Other than that, we're going to have you rinse with the mouth rinse, and then you get to sit back and relax.
This is going to sound like a silly question, but I'm usually coming to the dentist from somewhere else. And I know that when I walk in, I tend to use the bathroom before I go in for my appointment. Will people still be able to use the bathroom?
Absolutely.
Is that a silly question? I don't even know.
You know what? Everything is so new. There are no silly questions because we're going through this. We're all going to be in the same boat. We're working out all the kinks. We're working out the actual workflow. What I'm telling you today, may change in a month or two from now, as we gather new information. But for now, with the information we have, we want to make sure we're keeping all of our patients protected. We want to make sure we're keeping ourselves protected. And we just want to minimize people that are in the office. We want to maximize the time that you're here.
And then is everything sterilized in between people? I mean,
absolutely. I mean, that, what's great and what's been interesting is that we've been doing this all along. Dental office is probably one of the cleanest environments around. It's just now that we're stepping it up even more. We've been wearing, PPE, and it's funny when we say that word now, or we say that an acronym, everyone knows what you're talking about. But that 3 months ago or 4 months ago, we were like, "What's PPE?"
Right. I didn't know. Yeah.
So life has changed, but we've always been wearing, masks, gloves, clothing to protect ourselves. The difference is that you'll start to see us wearing these types of splash shields.
I was going to ask if you had one, what that looks like, and you can clean my teeth just as well and do surgery just as well with that on.
Yeah, it's just looking through another clear barrier is what that is. And then you'll notice we'll all be wearing long sleeves, some type of a gown that is disposable or laundered between patients. So it takes us, an extra minute or two to actually get dressed in order to come into the room to take care of you. But that's just going to be another part of our repertoire.
What about trying to get an appointment and get caught up to get back in? Yeah. Is there going to be a wait to get back in? Should people be calling you now to try and get scheduled? What do you suggest? I feel like there's going to be such a backlog of people who just even need their teeth cleaned.
So you are absolutely correct. There is 100% a backlog, and there's definitely people that want to get in. So we've got several categories. We've got people that need to come in because they've got active disease that needs to be treated. We've got people that want to come in because they, want to keep themselves healthy. We've got people that need to come in, but don't want to come in because they're afraid and nervous, right? So we've got this whole gamut of people. And so if you're one of those people that understands that we're doing everything we can to keep ourselves and our patients protected, and you want to have an appointment, definitely give us a call and let us know, because we'd love to get you in. We are scheduling a slower pace and fewer appointments. We have fewer practitioners working at one time. So it may be a little while before we get you in, but if you let us know that you want that appointment, we'll make sure that we do our best to accommodate as quickly as we can.
Well, you can certainly call me if there's a cancellation too, because I won't be anywhere else but sitting at home and waiting for my dentist appointment. A couple of questions that people are asking. One is, what is the most important thing you can do to keep your mouth healthy? And then funny, the question after that was, do you have to floss every day? I love flossing. My teeth feel so clean. Aren't you ever surprised by what's in them after you floss and you thought they were clean? I don't know, Steve, you answer that. You
know, there are so many, the clinical answer and the answer, that we have to say is yes, it's important to floss every day. If you want to keep your teeth, flossing is the only proven way to get the food and bacteria out from in between your teeth. There are no ifs, ands, or buts. Now there's a lot of funny comments that have come around there, and but yes, I'm going to keep it professional and say yes, floss every day. Ideally, floss after every meal, but definitely do it at minimum once a day.
Yeah, but I love my teeth. I love cleaning my teeth and brushing my teeth. And so, yes, absolutely, you have to floss. Any other questions from anybody as we start to wrap up our day here? Steve, what is the most important thing people can be thinking about right now? Obviously, they want to call their dentist and get their appointment because, again, there's going to be a backlog. They're going to prepare for more time. But don't hesitate to call your dentist either if there's something that's bothering you, or there's a concern, or maybe there is something that they can do with you over a virtual appointment, right? And show pictures and video.
Those are all great questions. And the reality is, we have been, I want to say, shut down for 8 weeks. So we're getting our bearings, back to start treating all of our patients. That's number one. Number two, there's also a backlog in getting some of these personal protective items. So we can only see as many people as we can that we have the equipment to see. So there's definitely going to be a backlog of seeing people. So the best thing you can do is to let your dental office know that you are ready to come in, and that when they can see you, as soon as that they can see you, they will accommodate and get you in.
I have a question though. On the vanity side, what if somebody who still wants to get their teeth whitened or wants to get their teeth fixed, or maybe actually, what I only thought of just this second, what a perfect time to get cosmetic work done while we're all home, right? So are you still doing that stuff?
So as of next Monday, we will get back to doing that type of treatment. I'm actually doing a virtual consult right after this, talking to somebody about replacing some veneers that she had done 15 years ago. So this is the best time, and you're right. We're all home, and we're all wearing masks anyway. So so this is a perfect time. If you're not happy with your smile, this is the perfect opportunity for you to call and to at least have that consultation to find out what it would take to get you happy and proud to smile. Life's too short not to smile. I mean, look at your beautiful smile. Look at that. I love seeing that. That's what it's all about. We should all be smiling that big and showing off our pearly whites.
Well, and we all have some friends that, well, especially you in particular, because of the clients that you work with, but we all have friends that did not smile nearly as much. And you can see the pictures of them grinning or smirking in pictures. And then they get their teeth done and wonder why they waited so long. And now they have big smiles in pictures. So you really do change people's lives with their smile. And again, dentistry and your dental, is it your dental health or oral health is so important to the rest of your health. With that, we're just at a time. One of the things I want to bring up is that this week, as most people who watch us regularly know, this is the week that's in honor of my dad. My dad is battling cancer, and we have Dr. Lori Glimsher, who's the CEO of Dana-Farber, on Thursday. We'll be talking about that. Steve, that's something else that you do during your appointments is you cancer screen, right? Every appointment?
Yes, we do. Every appointment, we're doing an oral cancer screening, and we do our best to talk about it so that you're aware of what we're doing. But we want to make sure that, again, cancers show up everywhere in the body, but the signs of cancer or any kind of disease typically shows up in the mouth first.
Wow.
So whenever we see anything that's abnormal, we're going to let you know. We're going to take pictures of it. We're going to, we'll decide what the proper course is. But doing oral cancer screening is
that typical?
Exam.
Is that typical of dentist's office to check for cancer and do a cancer screen like that?
All dental offices should be doing that. So
okay.
If they're not, ask your dentist, or if you feel like they're not, make sure you ask.
Yeah, definitely important. We had asked last week for companies to sponsor $1,000 towards our fundraising for Dana-Farber this week. We are at just over $14,000 now. I think that's actually pretty amazing for just a few days and during this COVID time. The funds will or they're 100% going to Dana-Farber. The link goes straight to Dana-Farber to help support all of their efforts during this time, the extra safety precautions that they've put in, and of course their frontline workers supporting them. I just want to read off real quickly the sponsors that we have: Kramer Advisory, High Point Engineering, Commodore Builders, CPT Architects, Cabot and Forbes, the Goodale Company, Bullfinch, Michael and Heather Bajulian, Janitronics Building Services, Richmond Companies, Crosspoint Associates, and Callahan Construction Managers have all come in as $1,000 sponsors for our efforts for this week, and I want to thank them for that. And then just letting you know about the rest of this week, we have Elizabeth Segrin, the author of The Rocket Years. She's a senior staff writer for Fast Company, but she wrote a great book that I've been reading, and I can't wait for my kids to read. And it's about just your focus in your 20s. You can still have a good time and be figuring it out, but have purpose to it. And it will really help set yourself up for the rest of your life. So she's on tomorrow. Michael Grove is with Sasaki. He's one of the top urban planners in the world. He'll be talking about how we can bring our agriculture and our farming into our cities. They're doing it in Shanghai. They're doing it in the Philippines. And there's no reason they can't be doing it. We can't be doing it here. So we have our food sources right here. And then again on Thursday, Dr. Lori Glimsher will be on. She's the president and CEO of Dana-Farber Cancer Institute. So Steve, thank you so much. This is so important for everybody. Everybody go get your teeth cleaned and checked out, and because there's nothing better than a great smile. And I thank everybody for joining us again today, and we'll see you tomorrow.
Thank you.
Thank you.